2 years ago, I stood where I am today, shattered and heartbroken, after just losing my beloved daughter. I lost my daughter in a horrific manner and wanted to share my story for many reasons. But first, I wish to express my heartfelt gratitude to Pennsylvania State Representative Don Kiefer for sponsoring this legislation, as well as State Representative Frank Ryan for their never-ending fight for Sean's Law. And I extend my gratitude to Mr. Govan Martin, Suicide Prevention Alliance, and all who have joined in the fight to save so many vulnerable, precious lives. These past 2 years have been long and filled with pain, loss, and deep sadness, but they've also been filled with hope and the promise of turning action into advocacy and life-saving efforts to make sure this tragedy is less likely to happen to anyone else. I am determined to turn my daughter's tragedy into something good in hopes to save even one life. The horror I have lived through these past 2 years is unimaginable. This website is still running today, still preying on young children and vulnerable and encouraging them to end their lives. These monsters are pure evil. I will never stop fighting to shut them down. We must not allow these horrible predators to prey on our children and our vulnerable. We must send a clear message that this predatory behavior will not be tolerated and they will be prosecuted. None of the children that were encouraged to end their lives deserve to die. My child did not deserve to die. My daughter had her whole life ahead of her. But when you have websites like this that exist, people like my daughter don't even have a chance. Nikki Banas said, "Hope. If you only carry one thing throughout your entire life, let it be hope. Let it be hope that better things are always ahead. Let it be hope that you can even get through even the toughest of times. Let it be hope that you are stronger than any challenge that comes your way. Let it be hope that you are exactly where you are meant to be right now and that you're on the path to where you are meant to be, because during these times, hope will be the very thing that carries you through. We must be able to give our children hope that there is help available for them and a better tomorrow." I am forever grateful to everyone that has stood beside me, gave me the opportunity to speak up and speak out against this evil and bring this darkness to light. I will always fight to bring awareness to this site and turning Sean's tragedy into our legacy to save lives. No matter what threats and attacks I receive from this website, I will always fight back. After 2 long years, Sean's Law has now passed the House and Senate and is on its way to becoming another important life-saving tool in this country. So many thanks go out to all the beautiful friends I have made along the way and have shared or covered Sean's story. I am now calling on Governor Tom Wolf to sign this bill into law. I am also calling on our governor, his administration, and our state and federal lawmakers to increase resources for mental health IDD services and the entire system today. We must get people off these long wait lists and get them the help they need today, because they need our support now. We are also asking our state and federal leaders to work with the medical community to create incentives for our mental health profession to attract more individuals to this vital profession. So much needs to be done, and now is the time to act. From Olympians to family members and friends in need, mental health and mental wellness impacts all of us. Please make it Pennsylvania's priority. Please make it a priority in our country, and please use your voices to make a difference.
My name is Katrina LaRusso. I'm from Oliphant, Pennsylvania. I am a loss survivor. I lost my little brother to suicide 3 years ago on October 4th, 2018. And yeah, he's the reason I'm here today. He did a video 6 years prior to his death, and he wanted to get education in schools. He wanted to end bullying, and since he never got the chance to do so, I made it my mission just to speak up and be his voice and act, because I feel like so many people who want change, they complain that there's no change happening, but they don't want to speak up and do anything about it. So I started a nonprofit organization in his name, the Gina LaRusso Foundation for Suicide Awareness. And what we do is we raise money and we get education in our local schools. So we started off at Lackawanna College and we got mental health courses there. well, I don't want to end there, I want to continue. So I really think it's important to start doing as early as elementary school. I think it's important that we start teaching our kids at a young age that emotions are okay. It's okay to be happy, it's okay to be sad, it's okay to be mad, as long as they have the correct tools to teach them how to get those emotions out in a healthy way. And then moving into the middle school, I think it's okay to start talking about bipolar, depression, anxiety, because so many of our students are experiencing these issues. And then moving up to the high school, I think it's safe to start talking about suicide and other mental health illnesses, and then just letting them know that they're not alone and letting them know that help is available. I always said that Gino, he always had a smile on. I would have never knew 1,000 times you could have told me I would be standing here today, and I had no idea. I was in such disbelief learning what he did and why, because he always had a smile on. There was no way. So at the Gino LaRusso Foundation, we have a slogan, smile, wave, don't give up. And it's because I always say smile no matter what. A small smile goes a long way. So we have to spread the love and keep on smiling. And then wave, because it's important to wave all the negative away. And then don't give up, because no matter how hard life gets, we can never give up. And we just got to keep going and letting those know that help is available.
I'm honored to be here at Capitol Day. I look forward to it. I think not being a loss survivor, but yet my role is in a nonprofit, a suicide prevention nonprofit. And one of the things that I feel so important about is talking about suicide, and that the silence really adds to the stigma. And I see that as one of the biggest barriers to stopping suicide, is people are afraid to say they're feeling this way, or people are afraid to ask for help. And so days like this, Capitol Days like this, is just wonderful, because it gives people a chance to talk about suicide, promote prevention, identify maybe what we still need. And so it's really, really important.
My face is a face of suicide. My name is a name of suicide. I attempted twice to remove my name and face from this world. Saying that out loud sometimes makes people uncomfortable, as if there was something wrong with me, as if there were some glitch in the matrix for being able to stand here today after 2 failed attempts and be able to speak with you. We recognize the month of September as Suicide Prevention and Awareness Month. And while I'm grateful for a whole month to have our fight highlighted, for many of us, this fight is every day. As advocates, our conversations must happen in every corner, at every table. I cannot stress how important starting a conversation is. The saying, "It is better to be safe than sorry," couldn't be truer. There was no one to have that conversation with me. What I thought was clear and loud signs were left unseen, and questions were left unasked. I was left to the dark, to the silence that can cut a person deeper than anything else can in this world. That silence was judge and jury. We've got to get better at being comfortable taking and talking to each other, and even better at pausing to actively listen. No matter how long the conversation takes or how messy it is, we must be willing to trek through the mud with and for each other. We say it's okay not to be okay so often, and I believe it's because it sounds like the compassionate response and the things society tells us that we should say. As important as it is to have these conversations, we must be careful with our chosen words, and even more so with our body language and reactions. I want to share something I wrote recently that speaks exactly to this point. I feel guilty for being alive. I recently spent a few days at a training filled with individuals who are advocates, the doers of this work. It wasn't something new, at least being in the same room with like-minded people. What was new were the individual reactions from people when they heard my story. or the 4 words I had become increasingly comfortable with saying and not being judged by. A 2-time attempt survivor. There were audible gasps, the kinds that you expect from telling someone something so shocking that they're horrified and they're clutching their pearls. There were visible expressions, not the ones I'm used to seeing. Some were shocked, some were even angry, clearly the opposite of the usual empathetic responses I had grown accustomed to. The worst, however, were the physical retraction, as if I carried some transmittable disease and distancing themselves from me made sense. Suddenly, I felt guilty for being alive in a room where there were individuals who lost the people that they loved to suicide. Here I am, accidentally alive, and their brothers, their sisters, their mothers, individuals that they loved, weren't. My rational brain tells me that these situations are complex, but it isn't enough to help me catch my breath again. My spirit has literally been knocked from me because of carelessness. Intentional or not does not render the wound any less painful. I'd be lying if I said I'd gotten past those encounters. I'm not sure I ever will. It had been the first time that I had ever felt guilty for being here. As if a failed attempt meant accidentally alive, which absolutely called into question, does accidentally alive mean having no purpose? You see how quickly the wind can be taken from someone and how crucial it is for our empathy to prevail. Attempt survivors are an incredible resource, but so few are willing or able to speak because of these types of reactions. We aren't just data points. We aren't some carnival sideshow that's broken out during a month of September for a spotlight interview or to raise money. I once stood in a room full of stakeholders, and when I finally had heard enough from reported experts in the field, I asked for the microphone and then asked a simple question. How many of you have an attempt survivor on your board, in your organization, on your task force? The silence in the room was deafening, and not a single hand rose. That, I said, is your problem. It's no secret that those that know me, and I suppose even looking at me, you can tell that I have zero reservations in saying the things that need to be said. It doesn't come from a place of ill intent or anger, but from a front row seat lived experience. Despite all the experts, the clinicians, the individuals who know everything there is to know, we are still losing people. Our work needs to be a combination of everyone in the room having an equal part in the discussion. Maybe it isn't a table and seats. Maybe it's more like one of those old wagon wheels, the kind with the spokes. You know, they're all even the same length to support the weight, the integrity. If we're all not working together, if we're all not valuing each story, each voice with as much equality as the next, despite the PhD or any other letter before or after the name, we're not going to last long on this road, and we're certainly going to continue to lose people. We must be willing to be raw, to be truthful, but with grace and empathy, and we must mean it. In a world where we get wrapped up by the pace and ongoings, the noise, the divide, we must be present and persistent with each other. Hindsight 2020 is too late. So here's the thing. Today, tomorrow, the day after, check in on your humans and mean it. Check in on the ones that look like they're fine, the strong ones, the ones carrying the weight well, the quiet ones and the not so quiet ones. Listen to responses, to tone, to pauses. It is often what isn't said that speaks volumes. And if you need a check-in, but you're usually the one doing the check-in, be open and honest with the people you're looking in on. Say, checking in for both of us today. Being an attempt survivor is one part of who I am. It does define me, but not in the ways society has deemed them. I am resilient. I am loud. I am here to call out where we are failing, but I'm also here to help resolve those shortcomings. My name is Amanda Hammock. I'm a mother, a wife, someone's friend, an advocate, a survivor. I am not accidentally alive. There is purpose to my story, as there is to all of ours.
18 years ago, I was in a small boat fishing in Atlantic City, a big boat with drunken kids at a high rate of speed hit the side of our boat. I was on the front of the boat, and when the wake came, I went up in the air, I crushed T12, went up in the air, and crushed L1. In that split second, my life changed. It took me a very long time to accept the fact that I was in a chair. I was angry, then I had pity, and I never thought that I would be able to live a full life. I honestly contemplated committing suicide because I thought I would never be a whole person. And it was a good friend of mine who helped me find my faith because I had lost it. And I honestly believe that God wanted me to be an advocate for physically challenged people because I'm in a position to do that. And that's why every year I introduce Suicide Prevention Month in Pennsylvania. If you feel that you want to take your life, there are resources out there that can help you. There's a helpline, and I'm sure the other folks at the press conference have given that phone number. You're not alone. I was lucky that I had a support system. There are people out there who will help and support you. And if you need help, don't be embarrassed to say, I need help.
My name's Jennifer O'Mara. I'm a state representative in Delaware County, and I'm here today because I am a family member of someone who died by suicide. When I was 13, my dad died by gun suicide, and he was a firefighter in Philadelphia. For many, many years, I didn't talk about it with people. I felt shame. I didn't want people to judge me, and I didn't know that there were other people out there who were also survivors. When I decided to run for office, I decided that it was time to share my story and that I would try and use what happened to my dad and to my family to help other people. In Harrisburg, I have passed legislation that is targeted at suicide prevention, and I'm committed to doing whatever I can to break the stigma that surrounds mental health. Too many people in our society die by suicide. And every single loss is a tragic heartbreak because it is preventable. That is why I am going to continue to do whatever I can to pass legislation, to have conversations, and to share my story so we can break the stigma that surrounds mental health and we can save even one more life.
My name is Jacinta Harman, and I am a licensed clinical social worker, and I have worked in the field of mental health for 20 years or so, and my hope today was to spend a little bit of time talking to everybody about how do we normalize the subject of suicide and suicide prevention. I would have, in my early days as a therapist, if you had asked me, why would I not straight out ask somebody if they had a plan to take their life, I would have said to you, because what if they said yes? Or worse, what if they said no and went home and ended their life? As a younger therapist, I would have skirted around it. I would have said things like, do you have a safety plan? Do you have somebody to support you at the weekend? You know, just trying to make sure that they had something that they were working towards until I would see them again. And then I had QPR training, which is a suicide prevention training, and that really helped me to learn how to ask the question in a very straight way. And so even now, I will say 20 years later, when you ask that question of somebody if they have a plan to take their life, it's still a scary thing. So what I wanted to say to people, therapist or not, we all understand that it's a hard question to ask. And so I just wanted people to know that it's okay to be scared. There's a way to not be scared to ask that question. And so in thinking about what I was going to say today, I was thinking about the reasons why people might not ask the question. You know, well, it's an awkward question to ask. Is this the time? Is it going to affect our therapeutic rapport? Because if you're sitting opposite me and you tell me that you have a plan to take your life, I'm going to do something about that, you know. And so you just have to sit there and say to yourself, I'm asking the question and I'm saving a life. And so if you think about suicidal from a medical model, suicide prevention from a medical model, this really is a major health crisis. It's a major health issue. On average, 132 people are killing themselves, are dying from suicide every day. And so I really just think about like the multiple appeals from just varying factors and different agencies to do something about suicide prevention, and it just always seems to fly under the radar. And so I was thinking about the medical model and remembering that there was a time that your primary care doctor wouldn't ask you those awkward, sensitive questions. Questions such as, you know, drug or alcohol use, recent weight gain, things like your eating patterns, sexual activity. You know, those questions are on every screener at every medical office that you go to. And so those questions have been normalized. We answer those questions without even thinking about it. These are important aspects of your health and your well-being. And so that's where we need to get to with suicide prevention, and thinking about how to ask the question. And so that's where I think the training is so important, because along the line somewhere in the physical health world, we have progressed towards making these awkward and sensitive questions less of a hurdle, you know. And when they ask these questions of you, they ask very matter-of-factly. They don't skirt around the question. You know, the screener at the hospital is, do you now have, or have you in the past had a plan to kill yourself? Those are the exact words that are on the screener. And so that's what I would like to just really have people focus on, that you have to be blunt in how you ask this question, because this is how you save people's lives. So, you know, that's a great speech and it's great thought, but how do we get to that comfort level? You know, that's where the key to this is. And so it's an overwhelming prospect to ask a person if they intend to save their life, but the way to get comfortable with it is education, training and empowerment. And I mean empowerment for the people who are asking the question. And so the thoughts, I'm almost done here, the thoughts I had around how we get to that comfort level is to have training and practice support for primary care doctors in their offices to help detect if somebody is suicidal. Mandatory QPR trainings for community facilitators, clergies, coaches, caregivers, nurses, teachers, pastors, youth leaders. I mean, I could go on and on and on, but I am a licensed clinical social worker. I have to do child clearances every year. I have to do an ethics training. These are mandatory things that I do, and I learn from them. And so if QPR was made a mandatory training, it would empower people to learn how to ask the question, how to persuade people to get help, and how to refer them, because that's the scary part. What do you do after they say yes? And so if you train these people in the community to be gatekeepers, you empower them and you put them in a position to direct a vulnerable population towards getting the help that they need. Public relations is another way. You know, we could, you know, use, you know, just have activities that for the general public around when trainings are available, where there are trainings are available. Anti-stigma campaigns. Use the media to get to those people who are out there at risk, you know. Flash those hotlines, you know. Everybody knows what the McDonald's arches are, so you flash those hotlines until people know what they are off by heart, you know. Who doesn't know the Nationwide jingle, you know? Nationwide is on your side, right? Don't put that in there. You know, that's where we need to get to. We need to normalize this. And I think that another important aspect of this is that we need to reach out to previous attempt survivors, because they need supports to be established and helplines that involve them, their family, their friends, and other people who might be involved in their care. And lastly, I just want to say, as a society, we spend a lot of time talking about how do we stop someone from killing themselves, when maybe the bigger question should be, why do they want to die? And so I would just think that if you ask that question, you show somebody that you care, you invest yourself in them, and you help guide them in the direction that they need to go. Suicide is preventable, not inevitable.
Hi, my name is Govan Martin. I'm Chair and Executive Director of Suicide Prevention Alliance, and I'm very proud to be here today, speaking to all of you. Today should be a good day, because there's lots of good news out there about how we're preventing suicide. The current statistics show that there's been a reduction of 833 deaths from suicide that occurred from 2018 to 2019. In Pennsylvania, we've had 133 reductions in suicides. In Pennsylvania, we established our first loss team. A loss team means local outreach to suicide survivors. They go out and talk to the people who just had a suicide happen in their immediate family. They provide comfort, they provide support. Again, great news. We also started 2 Hope Squads in Pennsylvania, one in Clearfield County, one in York County. Hope Squads are put in schools, teenagers that learn suicide prevention training and also mental health training to get them to help other teens and provide them the support, comfort, and also resources where they can get help in schools. Yet I am still not happy. We have to do more. We have to reach out to people who are suffering, not just a segment of the population, to all populations. There's still a stigma that's involved in suicide that's just untouched. A lot of people don't talk to attempt survivors. A lot of people don't talk to loss survivors. A lot of people don't talk to people who are having thoughts of suicide. We can't continue to do that. We can't continue to lose more lives to suicide. Again, even though there's good news that's currently going on, it's not enough. We need to do more. We must use our voices to cause change. Robert Kennedy once said, "The future does not belong to those who are content with today. Rather, it will belong to those who can blend vision, reason, courage, and a personal commitment." Join us in changing the future by starting the conversation and connecting through hope. If you or anybody else you know is having thoughts of suicide, we want you to reach out because we know there is help. Please call the National Suicide Prevention Lifeline at 1-800-273-8255. You can also contact the Crisis Text Line and text 741-741, and a crisis counselor will assist you immediately. If for any reason you are put on hold or delay, please call your local crisis intervention line in your own county or call 911. There is help. There is hope.